Okay, welcome everyone. I think we will begin. My name is Jamie Schenker-Passero. I am an Associate Director at Temple Small Business Development Center. We help small businesses start and grow, and we do this with our no-cost consulting and with our roster of webinars like the one that we have today. We have a very full roster of webinars, in fact, and I'll try to share a link at the end. If you have any questions about SBDC services, I'm happy to answer that for you. Today, we are joined by Scott Yeager from Penny and Gregory Gutierrez from CHIP, who will be giving a broad overview about how entrepreneurs can navigate the health insurance process, which we know it's a little bit intimidating. We know that that's maybe an impediment to even entering entrepreneurship, thinking about, oh, it's so nice to have health insurance coverage by my employer. It's very safe, feels good. What do I do? What do I do when I start my own business and I don't have that safety net of my employer's insurance coverage? So today we're going to talk about how that process is not so intimidating after all. And let's see the results from our poll. We have many of you not having purchased health insurance independently for your family, so the vast majority. Let me share the results. So that's what we're looking at. Most of you are in that ballpark, which means that you are in the right place. And just for housekeeping, we have participants muted. We're going to ask if you have questions to put them in the Q&A, and I will have our panelists answer at the end when their presentations are over. They'll both be delivering mini presentations for you today. And I also want to mention that tomorrow we will be hosting office hours with Gregory and Scott, specifically to answer more personalized questions. So for today, if you have general questions that might be useful to somebody else in the room, that's what today is for. But we want to keep tomorrow open so there's more personalized questions, and maybe set you up for a one-on-one appointment as a next step to help you with your specific navigation of the world of health insurance for entrepreneurs. Okay, so that's how today will go. We'll send follow-up materials today, and that will include a link to join tomorrow. You don't have to register. It'll just be an open Zoom link where you can come and ask questions. So we'll have that open for an hour. You can pop in if it's whenever it's convenient for you. Thank you for everyone introducing themselves in the chat. That's great. And I think what I will do now is hand the Zoom screen over to Gregory. Let me make sure that he can share screen. And we can begin with his portion. Are you good to share your screen, Gregory?
Sure.
Perfect.
All right. Well, thank you so much, everybody. Thank you so much to Jamie and to everybody attending. I really appreciate you giving me some of your time out of your busy schedules. And today what we're going to talk about is the CHIP program. And the CHIP program is a program specifically for kids from birth up to the age of 19. So why did Jamie bring me in here? As she was saying earlier, sometimes it's very difficult to leave the comfort of an employer plan where everything's taken care of and go on your own. And as a parent, like myself, I know some of you are parents, it's very difficult to leave that, especially if you have kids. And what the CHIP program is something that's a safety net for you and your family. And that's what we're going to talk about. Okay. Right. So it's going to be an overview of the program itself, how can your child enroll, some of the plan and coverage details, and also how to apply. One thing that I want to say up front is that a lot of people have a misconception about CHIP. A lot of people think it's a type of Medicaid program. It's people who have lower income, but it's not. It's for working class families like you and I. It's for families that do have an income. So for CHIP, there is a floor, meaning if you go below a certain income level, you would most likely would qualify for Medicaid, medical assistance. But there's no ceiling. You can make up to $1 million and apply for the CHIP program. And that helps out entrepreneurs like yourself who have a steady income, but maybe don't have a high enough income to put a family on, say, like a gold plan or a small group plan yet. That's where CHIP would come in. Oops. Sorry here. Okay. So our CHIP is Independence Blue Cross, and you have access to the Keystone HMO network, which means you have access to amazing hospitals such as CHOP, University of Penn, Temple University, Nemours DuPont, all the major hospitals in the area are in our network. And also you have access to one of the largest doctor networks in the area. So a lot of doctors that your child currently sees now, there's a good chance they'll be in our network. And we're accessible to you 24/7 online, even in person, over the phone. However, it might be good for you to contact us because right now during the pandemic, we're doing everything virtual. We're there for you. So let's get started. So what is CHIP? Children's Health Insurance Program. It's a state and friendly health insurance program. And it's for children, like I said before, from 0 to birth who are not eligible for Medicaid or Medicare. If your child's on Medicare, most likely they're disabled. And if they're on medical assistance, then most likely you would not qualify for the program. Also, CHIP provides comprehensive coverage, such as medical, dental, vision, hearing, and prescription. They're all included in this plan, so it's very comprehensive. So a lot of people don't understand is like, how do I figure out my monthly premium? How does that figure it out? It's going to depend on your household size and family income. And I'll show you the guidelines a little later. Okay. So one important thing I want to emphasize again is that no household makes too much money to enroll in CHIP. Like I said before, you can make up to $1 million and still apply for the CHIP program. And of course, I want to restate that our network is one of the largest in the area, that we have CHOP included, Temple, St. Christopher's Hospital for Children, and Nemours DuPont. Now, how can this help you specifically? Well, sometimes an entrepreneur, if you have employees, you might have to choose a health plan with a higher deductible to save on cost. Well, the CHIP plan does not have any deductibles. It's straight copays. So you're only paying copays when you get medical services. If you've lost your job, now as we know, COBRA can be very expensive. So what you can do as the employee and the spouse, you can stay on your group plan through COBRA and put your kids on a separate CHIP plan. And also, even at work right now, or if you have a small group plan right now that maybe just has a high deductible, or maybe it's very expensive to add out your kids onto the policy, you can have your policy through work and also put your kids on a separate CHIP plan. So that's allowed. A lot of plans that say, hey, if you have health coverage through work, or if you have a qualified health plan, you can't use another plan. No, you can put your kids on CHIP and still keep your coverage through your small group plan or even employer plan. Okay, so how could my child enroll? Well, they have to be under the age of 19. So it's birth up to the age of 18. Once they turn 19, they'll be dropped off. They must reside in the service area of Bucks, Chester, Delaware, Philadelphia County, and Montgomery. They must be here within at least 6 months prior to applying. Now, they must be a U.S. national, U.S. citizen, or qualified alien. Basically, what we're saying is the child must be documented. I work at Kennett Square, where it has a large immigrant population. Sometimes the status of the parents is not clear, but we don't care. As long as the child is documented, the child can apply for CHIP. We do not ask the status of the parents. And of course, as I said before, they cannot be eligible for Medicaid or Medicare, and they cannot be covered by another health plan. CHIP can never be secondary, it has to be primary. So even right now, if your child has a plan, let's say you're in open year enrollment period right now to start September 1st, you can apply for CHIP on the application. It'll have an end date. All you would do is just put down an end date of August 30th, and your child could start September 1st for CHIP. okay? So why us? Why this plan? Well, first of all, there's no deductibles for any services. And that's fantastic because a lot of plans have turned to higher deductibles just to save money, but not CHIP. It's going to be straight copays. And of course, all your child's well visits, your physicals, the vision, the dental, all those annual well visits are going to be covered at zero cost. Now it's an HMO, so you have to choose a primary care physician and stay within network. And what's important is that there's no copays for inpatient, outpatient behavioral health or substance use services. So right now we know that in these trying times that a lot of kids need mental health services, but there'll be no copays for that. And emergency room copays are waived if you're admitted. So that's another plus. Now, before we go into the cost, Jamie, is it possible we can do the first poll?
Sure thing.
Okay. So what do you think? What concerns you most about offering health coverage to employees, to people who may have their own business or thinking about starting their business and may have one or two people? Do you think it's the cost of providing health coverage to employees, or how much your employees have to contribute? Let's see, or how much your employees would have to pay for coverage to cover their kids? I have suspicion it's number one.
Let's give it
Well,
another few seconds and then I'll end the polling.
okay.
Looks like you were right.
Yeah. Well, yeah, that's obviously, and I hope this will help out some of you out there as you venture forth, that you'll have some cost savings by joining CHIP. So as you see here, there's a different levels of what the plan costs. Now, again, like I said, it's based on family size and income. So, and I'll show you those guidelines a little later. So let's just say your income level and family size falls within free CHIP, which that means is you will not have a monthly premium, or you won't pay any co-pays for any of the services you receive. Now, as you see for low cost, it just means that your income has gone up, the family size has changed. So there's CHIP 1, CHIP 2, CHIP 3, and that's per month per child. And as you see, they're very reasonable. Then there's full CHIP. That means that your family size and income has just reached above a certain level. And no matter how much, maybe you make $1 million, you're still going to pay that $388 a month. So one thing I want to point out is that even if you're on full cost, that does not mean you're getting more benefits than if you're on free CHIP. You get the same exact benefits all throughout the plan. The only thing that's going to be different is you're going to be your co-pays. That's it. And your monthly premium, obviously.
Gregory, I'm wondering if the attendees are surprised by the co-pays, like if they thought maybe it would be a lot higher. If anybody's surprised, maybe do the hand raise. So I would love to know how people are taking this information. Okay. Anyone? Or you can comment as well. Yeah, we have some. Yeah, because I feel like that does seem maybe less scary, right? So I think it's worth pausing on that for a moment and appreciating, because that might be really exciting information for some people. That's all I wanted to say.
Well, good. Thank you, Jamie. That's a great point. Well, another money saver, if you have a large family, let's say you have 5 kids, with CHIP, you're only going to pay for the first 3. So if you have 5 kids, you're only paying for the first 3, which is a huge money saver throughout the year. Okay. And as you see this, you'll like those co-pays very, very low, very, very low, very reasonable. In fact, I wish I worked for the company, and well, I'll just stop there. The best thing, no deductibles, no deductibles. Okay. So every time you're going to go get some services, co-pays, that's it. A lot of people who have deductibles now are wondering, why am I paying out of my check every 2 weeks, and every time I get services, I got to pay towards that? With CHIP, just deductibles. And as we said before, free. If you qualify for free CHIP, that means you'll have no co-pays. Low cost, you'll see they're very reasonable. Going to a doctor, only $5. Going to a specialist, $10. Emergency is $25. Same thing with full cost. Going to a doctor is $15. Specialist is $25. Emergency room care is $50. Now, if you're admitted to the hospital through the emergency room, the copays are waived, but also we have a large network of urgent care centers in the area. So those copays may be less expensive than what you would pay. Now, if you want, I want you to look at the last line, hospital services, no out-of-pocket cost. If your child, heaven forbid, has to be an inpatient overnight in the hospital, the labs, the x-rays, the surgeries, the therapies, the radiologies, there's no out-of-pocket cost. As long as it's medically necessary and authorized, you're not going to pay anything. And that's going to include, I'm sorry, jump there. And that's going to include CHOP, Penn, Temple, St. Christopher's, Demars, all the hospitals in our network, no out-of-pocket cost. And of course, pharmacy is included. And as you see, the copays are very low. For low cost, generics are $6 for a 1 month supply. Brands are going to be $9 for 1 month supply. In full cost, it's $10 and $18, still very low. Now, we also have a special feature, which is mail order. So instead of going to the pharmacy every month, say your child has a maintenance medication, like an asthma, they have to get an inhaler every month, you can do mail order, get 3 months worth of supply for only 2 months worth of copay. That's a huge savings throughout the year. And of course, all the major players are in our network, Walgreens, CVS, Rite Aid, and also a bunch of the mom and pop pharmacies that are in your local area too. Now, of course, we want your child to be safe. We want them to make sure the medications are going to be appropriate. So we do have some safety nets, such as prior authorization. We want to make sure it's age appropriate, make sure it's being the right amount, it's being prescribed to you. Also age and gender limits, same thing. Quality level limits, they fall within a certain range that your child's supposed to have. Also, 96-hour temporary supply program. If your child's on a certain type of medication that needs prior authorizations, and maybe they don't have it right now, you'll get emergency 96-hour supply while that prior authorization is being reviewed. And this is just strictly for the safety of your child. Now, also included is dental at no extra cost. Now, you can see here, everything you'd get once every 6 months, the cleanings, the x-rays, cavities, fillings, covered at 100%. And it's a PPO, so there's a lot of dentists in our network. If you look at the last line, orthodontic services, braces are covered at 100% as long as it's medically necessary. That's the catch. Can't be just cosmetic, has to be medically necessary, okay? But braces are covered at 100% if medically necessary. Also, vision is included. Your annual eye exam is going to be covered. It also covers frames and lenses. We have a large network of Davis Vision providers. That's the network we use. And this is strictly for eyeglass, not anything you would have to take an ophthalmologist for, say, an eye injury or see a specialist for. And included in this coverage is a $130 allowance towards frames. And also, if you use a certain Davis collection of frames, it's covered at 100%. So there's no extra, so there's no out-of-pocket cost. But if you have that little fashionista who needs those $200 frames, all you're going to do is pay that $70 difference. It's a very, very good plan. And also contact lenses, same thing. They're on the formulary, no cost. If they're off the formulary, $130 allowance. That's a big money saver. Now, these are just add-ons that sometimes you would normally get for your glasses. And as you see, they're very low costing, very low copays. And I called one vision provider. Some of these are over $300. That's another way you can save money with the CHIP program. Okay. One extra that you get with us with Independence is you get health coaches. So you get nurse health coaches. Let's say your child has diabetes. You can call one of our nurse health coaches and they'll help you out, help you with a dietary plan, an exercise plan. Maybe ask questions or answer questions you didn't think to ask your doctor, or maybe bring up some things that maybe you should ask the doctor. Also, it's just an extra layer of protection, help supplement the relationship that you have with you and your doctor. Also, there's IBX Wire, basically their discount programs. What's included is that you'll get emails and texts regarding your plan if there are any changes, renewal reminders. Also, you get cost savings alerts. Also, you'll get Blue 360, which gives you discounts from over-the-counter medication to sneakers, and also Blue, and I just drew a blank. It's Blue. You would get discounts on local businesses such as the Blue Cross River. You would get a discount on admissions. And this is just standard. Of course, anything that needs to be medically approved, pre-approval, has to go through that process. That is a standard. Anything that has to go through your primary care physician, they'll take care of it, such as referring you to a specialist. So complaint and grievance, we have a process for that also. And you're gonna be exclusions. It's pretty much boilerplate. Like any plan, they'll have standard exclusions. It's in the member handbook, such as cosmetic, anything experimental will not be covered. Now, how do you apply? You can call us, 800-464-5437. Go to our website, ibx.com/chip, download an application. It's writable, very easy. And also has the compass line. You can call there and go through that. Also, if English is not the primary language spoken in the household, that's okay. We have access to a language line, which features translators for over 70 different languages. You would just call up and just say Russian. The rep would just call language line, get a Russian interpreter. You can do an application over the phone. Or you can get more of me. If you haven't had enough, you need more Greg, you can give me a call, 215-241-9706. You can email me, gregory.gutierrez@ibx.com. I also speak Spanish, so I can help with Spanish-speaking families. If you have questions on basically how to apply, walk through the process, not sure, please reach out. Jamie has my information. Be more than happy to apply. And if I could just share one more thing, Jamie. Let me just get out of here.
Sure.
Okay. And can you see this? I'm sorry.
Yeah, we can see it.
Okay. So these are the guidelines. Let's see. Okay. So I hope you can see them. The way it would work is that the family size, what's on the left, say family of 4, those at the level of your household income, whoever's working in the house, even if you're unemployed, one spouse is unemployed, you'd still would factor in your unemployment. You go across how many kids you have, go up top, that's how much you would pay. So family of 4, if your income is between $56,000 and $69,000, you're only going to pay $45 a month per child. All right.
Is that something that we can share, this flyer?
Sure.
Perfect.
Sure. I can send that to you, no problem.
Awesome.
And also, do we have time for the last polling question?
Yeah, I will get that going.
Okay. All right. Well, let me ask you, what do you think employers, what do you think employees are, what benefits do you think employees are most important? Surprised, no one's going for the ice cream. Maybe it's just me.
Greg, I actually was about to say, if I were given any input on this, that 2 gallons of ice cream, I would definitely be in favor of that. So
Now that's a perk. Wow, the health coverage. Well, it's really interesting. Just goes to show that, yes, we know that here that health coverage can be very burdensome and very scary. And we're very happy to help amazing people like Jamie and their fantastic organization at Temple University. We're just here to help out. And please, you have my information, any questions, no matter how small, never a dumb question, reach out. And again, thank you so much, Jamie. Thank you everybody else for attending, and best of luck on your venture going forward.
Thanks,
Much success.
So there are a few questions just for Chip, so let's get to those now quickly.
Okay.
One question, when you went over the monthly the monthly maximum premiums, is that the amount the employer pays? And I think the answer is that the individual who is getting their own insurance is paying this.
The individual who's getting the insurance is paying this. This would be completely outside the employer.
Right.
So you
this
get
is
getting this on your own, basically.
You're an entrepreneur, you're getting your own coverage. That's what your premium would be. Okay, so we answered that. If your child is in college and living with you, what's the maximum age they can they can be to remain covered?
Up to the age of 18. So at 19, they have to drop off.
Okay, and is this available to entrepreneurs in the Philly area? I own a business in the Pittsburgh area. Are there other programs there?
Yeah, CHIP is statewide, just handled by different insurance carriers. So I'm sure there's an insurance carrier that does it in the Pittsburgh area.
Okay, that's a good differentiation. So you have CHIP, and then this is via Independence.
Correct. For
Okay.
Southeast Pennsylvania.
Okay. And someone else asked, how is the cost determined for the applicant? It's the income and household type, which I guess you just answered by bringing up this last sheet. So we'll make sure everybody sends that out. So I think that's all the questions for Greg specifically. Again, Greg will be with us tomorrow at 4 for more personal questions if you have them, and I'll share that link in the chat. But for now, I will hand the floor over to Scott.
All right, Jamie, thank you so much. And thank you, Greg, for sharing the information related to CHIP. My name's Scott Yeager. I am the outreach manager at Penny. And if you haven't heard of Penny, it's okay. We are a brand new state agency. We've been around public facing for about 8 months. Okay. The one thing that I can assure you about CHIP and Penny is that Penny has a no wrong door policy. We are Pennsylvania's official replacement for healthcare.gov. Okay. We are statewide. And again, we have a no wrong door policy. So if an individual who's a sole proprietor, who is a small business owner, who's a small precision manufacturer, if they have employees that come to us, if they themselves come to us as individuals who are breaking out on a new venture, if they come to us and they're seeking health insurance for themselves and for their children, as well as dental insurance options, Penny's here to help. So I'll tell you a little bit about who we are, and I'm going to go through this briefly so that we can get to some questions if you have them. Penny, as an agency, we were given birth to by a 100% bipartisan, unanimous effort through both chambers of the Pennsylvania General Assembly. We were signed into law on July 2nd of 2019. Okay. Why? Well, because every year the Commonwealth of Pennsylvania would write a check for about $98 million and send it to healthcare.gov. And we thought to ourselves, there were a group of very forward-thinking legislators and policymakers in Harrisburg who got together and said, you know what? We can do this better. We can save the Commonwealth of Pennsylvania millions of dollars. Oh yeah, and we can also craft and create a health insurance exchange that is unique to Pennsylvania, provides financial assistance for sole proprietors, small business owners, and small precision manufacturers, and be in a position where we can create a competitive marketplace and have a reinsurance program set aside to help regulate the cost associated with health insurance rates and premiums. Now, I mentioned this to you because everyone on this call can probably nod their heads vigorously over the fact that you can have the best health insurance on the planet, but if people cannot afford it, and even worse yet, if people can afford it but are afraid to employ it, utilize it, then you've got a boat on dry land. And that's where Penny is here to help. And We actually had our official launch on November 1st of 2020. We have been around for 8 months. So if you haven't heard of us, stay tuned, because you will. We are about to head into our second open enrollment period, which starts November of 2021. Currently, we are in our COVID-19 enrollment period, which launched on February 15th of 2021 and will end on August 15th of 2021. During this particular window of time, we launched and that's part of the benefit of having a state-based exchange. We have the ability to do things that the federal marketplace cannot. And we do so for the benefit of Pennsylvania residents. We've been able to insure thousands because of our COVID-19 enrollment period, specifically because, number one, we're waking people up to the fact that we have great insurance options, both health and dental, and we have financial assistance to help not only the unemployed, people who are in transition right now, and there are a lot of our friends and neighbors who are, but there are just as many of our friends and neighbors who are in a position right now where they're saying, you know what, I've worked for other individuals for 15, 20 years. I can hang my own shingle. I can start my own business. And they're doing it. Just like you, they are taking that initiative. They are creating out of what has been an incredibly difficult time for the Commonwealth of Pennsylvania from an economic perspective. They're taking that challenge and they're saying, you know what, I can create my own opportunity. But a big part of that is being able to insure yourselves, to protect your quality of life, to protect your employees' quality of life. And that's basically who we help. We're here to help the individuals who don't qualify for Medicaid, who are too young to qualify for Medicare, but they don't qualify for employer-sponsored coverage or group benefits. That's what we're here to help with. And again, there are about 607,000 uninsured in the Commonwealth of Pennsylvania. We're definitely here to help those individuals, and I'll show you here in a second what that looks like. But again, I can't stress this enough. The information that Greg shared with you about the CHIP program is incredibly important, because throughout the Commonwealth of Pennsylvania, there is no reason in 2021 why any child should be without health or dental insurance. And CHIP is an incredibly robust vehicle in order to make sure that our children here in the Commonwealth are protected. In addition to that, we here at Penny, we don't work for insurance companies. That's something that you need to understand. We work for you. We work for the small business owner, the sole proprietor, the small precision manufacturer, the individual who is taking the initiative to create and carve out their own future here in the Commonwealth of Pennsylvania. Those are the people that we serve. And we have a no wrong door policy. So if it's determined that, yes, you may qualify for health insurance through Penny, but your children may be better served through CHIP, we have a warm person-to-person transfer that we employ here at Penny to make sure that your children get the coverage that they need. If your employees, for whatever reason, if they don't qualify for Penny for health insurance or dental insurance through Penny, we have that warm person-to-person transfer to the county assistance offices that will help them get connected with the Medicaid resources and the CHIP resources that are available to them that they do qualify for. So please keep that in mind. All of our services are free here at Penny. Our customer service team is 100% unbiased. Again, we don't work for insurance companies. Our agenda is protecting the people of the Commonwealth of Pennsylvania, and I cannot stress that to you more than what I am now. We are here to help protect your quality of life, okay? We have penny.com, which is our online self-service portal. It is not penny.gov. It is not penny.pa.gov. It is penny.com, because we want to be a universal resource, just like the legislation that gave birth to us. We want to make sure that every Pennsylvanian is aware of the fact that they can be serviced through Penny for free and get connected to that health insurance that they need. The only thing that would ever cost you at Penny, even working locally with our Penny certified assisters or brokers in your local area, the only thing that would ever cost you is your binder payment for your first month's premium. Aside from that, you can work with any customer service representative, assister, or broker in your region for free. When we talk about the uninsured in Pennsylvania, there are a lot of our friends and neighbors. About 1 in 20 of our friends and neighbors go without health insurance in 2021. Again, people make tough decisions. Why? Because they are unemployed, they receive that COBRA letter, and well, it's the difference between paying for health insurance through COBRA or making their mortgage payment, or being in a position where they're starting a new business and being able to cover their costs associated with that. Penny's here to help. So when you take a look at this map, yes, the darker the green, the more significant the population of uninsured. But here's the thing. Please keep in mind, yes, you can look at southeastern Pennsylvania, you can look at southwestern Pennsylvania, but when you take a look at north central Pennsylvania, don't be fooled. Don't be fooled. The number of insured here reflects population density as well. There are a lot of individuals that are uninsured throughout the Commonwealth that quite honestly don't need to be. And that's where Penny comes in. We, through the American Rescue Plan, we're in a position where we have increased levels of financial assistance. For 2021 and 2022, there are more generous levels of advanced premium tax credits to help individuals from all income levels. Okay, going back to what Greg said about the fact that CHIP, you can qualify for CHIP regardless of how much income you make. Well, guess what? We're in a position right now with Penny where you can receive financial assistance, and your income is going to be capped at 8.5%, basically over the 400% of the federal poverty line. So it is an unprecedented time in the Commonwealth of Pennsylvania for people who don't have insurance to get insured, okay? Also, many of you know people in our communities who are unemployed. Please do not hesitate to refer them to penny.com. The reason being is because through 2021, we have it established so that anyone who qualified for at least 1 week of unemployment compensation during 2021, whether or not they actually collected the cash benefit, can apply for our second lowest cost silver plan. That's really, really good insurance. Our second lowest cost silver plan at $0 a month. So again, we're trying our best to make sure that people get protected. Right now, we have our COVID-19 enrollment period open until August 15th. I mentioned this to you because we're practicing the first of each month in terms of the enrollment. So you could have somebody who applies for health insurance July 31st, and they'll be covered August 1. Okay, that's significant for a lot of people. You can have somebody, who applies through August 15th, and they'll be covered on September 1. August 15th is when our COVID-19 enrollment period ends. But here's the thing, there's a COBRA open enrollment period that picks up August 2nd. Because again, we have a lot of friends and neighbors right now who are unemployed. They might be receiving a COBRA subsidy right now through the American Rescue Plan, but that COBRA subsidy ends on September 30th. Well, guess what? Penny, because we have local control as a state-based marketplace, our board of directors has already taken action and said, you know what, we're going to make sure that nobody loses coverage. They're going to have the opportunity to connect with Penny to receive the coverage that they deserve. Now, again, keeping with the idea that people can be protected and covered if they can afford to have the insurance. Here's the cool thing. Since we've implemented the American Rescue Plan at Penny, nearly 53% of our customers, and we have 327,000 plus customers here at Penny, they qualify for health insurance that's less than $1. 53% of our customers are paying less than $1. 71% of our customers are paying less than $50 a month. Most people pay more for a cell phone bill or a cable bill than we have. Now, I have some scenarios that I'd like to quickly share with you. And again, please keep in mind, Jamie had mentioned that we are going to have a follow-up session to this tomorrow, and I am all about making sure that people have access to tools that they need to make the decisions that are right for them, for their employees, etc. We will be sharing some of that information tomorrow. So please, if you have time, join us. It'll be well worth your option. Jamie, was there another poll question that we wanted to ask?
Was there?
No, I was just checking with you. I just wanted to be sure. But again, I wanted to be able to remind folks that we are having the session tomorrow at 4 o'clock. Please, if you have deeper questions, we will do our best to make sure that you get the answers that you need. Going over some scenarios that, again, would be pertinent for you. The first scenario that we have here is a single 40-year-old non-smoker from Philadelphia County. This gentleman makes about $19,000 a year. Prior to the American Rescue Plan, he would have been paying for our second lowest cost silver plan, our benchmark plan at Penny, about $66 a month. Now, under the American Rescue Plan, he'll be paying $0 a month, saving him about $792 a year. Again, this is an important step that we've taken to help people get protected here in Pennsylvania. Second to that, we all know of a couple or an individual who may have done everything right, and they're in a position where they can, as my brother often reminds me, he is going to retire at the age of 62 years in one day. We have individuals like this who retired, they're 64 years old, they're too young to qualify for Medicare options, Medicare supplements, Medicare Advantage plans. So they pay for insurance on the individual health insurance market. This couple, prior to the American Rescue Plan, they would have paid $2,400 a month for their health insurance. Under the American Rescue Plan, again, remember I said we are capping income, and their income is $77,500 a year. We're capping that at 8.5% in terms of their financial assistance that they'll qualify for. This couple now through Penny would save almost $23,000 a year in terms of their insurance, their health insurance costs. Now, for a couple on a fixed income heading into what should be the best time of their life, that is ultimately life altering. Okay. But here's a more common scenario. More common scenario is you have a family of four. They make about $52,000 a year. Prior to the American Rescue Plan, this family would have paid about $285 a month for covering a family of four, which isn't all that bad. Now, under the American Rescue Plan, this same family of four pays about $87 a month, a little bit more than $20 a month to cover four people each, and saves about $2,300 a month in terms of, or I'm sorry, $2,300 a year in terms of their health insurance. So from this perspective, we're again doing a lot of good for the residents of the Commonwealth here at Penny. Another individual, again, regrettably, we know a lot of folks right now are between jobs, and many of them, like you, are saying, you know what, I'm about ready to go out and just hang my own shingle, start my own business. I'm tired of working for others. I'm going to start carving out a future for myself. And in this case, you have a 30-year-old from Lackawanna County. She falls into that category of individual that normally wouldn't receive any financial assistance. Now she's in a position where she does. She's currently unemployed and she's receiving unemployment compensation. Before the American Rescue Plan, she would have paid about $364 a month for her health insurance. Now, again, because she's unemployed and qualified for at least 1 week of unemployment in 2021, she pays $0 a month. That saves her about $4,300 a year in terms of her financial, or in terms of her health insurance and dental insurance. I mentioned before that Penny has 3 different levels of free assistance. Okay, we have our customer service representatives at 844-844-8040. Please understand this. You, your employees, your friends and neighbors who need health insurance can call 844-844-8040, and they will receive professional, unbiased, no hassle assistance in reviewing not only whether or not they qualify for financial assistance, but figuring out what health insurance and dental insurance options are best for them. If they need help at the local level, please understand we have certified assisters and certified brokers that are boots on the ground, literally within communities throughout southeastern Pennsylvania, throughout north central Pennsylvania, etc. And all of these individuals will provide you with free assistance in helping you, helping your employees figure out whether or not they have options in terms of health insurance. And again, please keep in mind, Penny is an unbiased resource. We have a no wrong door policy. If you need us, again, 844-844-8040, or just visit us at penny.com. With that, Jamie, I am going to turn things back over to you. And if there are questions, I'll be happy to help.
We do have a question. If you could just go over the income cap, especially how it would differentiate from the older marketplace. Maybe if there's something different about that now.
Yeah, sure. And in fact, that's a great question. And we do have a typically speaking, with the federal poverty line, if you were over, and this is the easiest way I can demonstrate this to you, if you were, as an individual, if you were over $51,000 a year, typically you wouldn't qualify for financial assistance. Okay, now you will. If you're a family of 4 and you are over 105,000 under the old model, you would not qualify for financial assistance. Guess what? Now you do. So that's why we're so excited. And again, we have about 607,000 of our friends and neighbors here in Pennsylvania that we're trying to get protected right now. Those include small business owners, sole proprietors, individuals, and believe me, I speak as someone who understands this. I have small business owners and sole proprietors in my family. And believe me, there have been times when they've had to make that tough decision about, okay, well, you know, I can't afford it. I just can't afford it. Well, guess what? This is a great time for you as a small business owner, for you as a sole proprietor, for you as a small precision manufacturer to reach out to us. Again, tomorrow during the 4 o'clock session, I will have some tools that I can provide you with that will give you the opportunity to unbiased. And again, we don't require you to set up an account at Penny to shop with us. Okay. We don't require your name, your phone number. We don't require your social security number. We don't require any of that. You can or anonymously shop through us. No pressure, no hassle. If you need help, we've got people here who can help you. They're not going to hard sell you. Our folks are here to make sure you get protected on your terms. So please know that we're here to help.
Awesome. All right. I am going to, in the chat, post a few things right now as you get some more questions in. I'm almost out of time for today. So first, I'm going to post a link to our resource document that I mentioned earlier. This will get you a roster of links to recordings that we've done. Maybe there's a previous session you said, oh no, I missed it. Our library of webinars is in there, as well as some easy ways to register for upcoming webinars that we have. I'm also going to post right now our survey for today. This is important for our continued funding of free webinars for you. So I'm going to post that now. Like I said, we're going to get some follow-up materials to you. I am also going to share the link for to join us tomorrow for office hours. I think I posted it already. I will post it again though. Did everyone see that? I can post it again just in case.
Yep. And Jamie, I think it was Geraldine who had a question about how to contact me.
Yeah.
At the beginning, I posted my contact information, and I just posted my contact information again in the chat. You are more than welcome to contact me. You can reach me. My cell phone number is there. I know that's kind of odd for a state employee to give a cell phone number, but guess what? I want you to call me. Okay, so call me, email me, send up a smoke signal. Yes, I'm here.
So there are some more questions coming in, but if anybody has to leave for today, that's no problem. You have the contact information for panelists. You have the link for tomorrow's office hours. You have the link to the survey, and you have the link to our resource document. So if you need to leave, no worries. We will stay a few more minutes for questions, but I do want to thank Gregory and Scott right now just for all the information that was provided. Hopefully it was soothing, you know, maybe I'll say, alleviating some major worries for our entrepreneurs, I'm really hoping. So thank you both, and I will get to some more questions. We have someone asking, are there medical exclusions regarding insurance via Penny? So
that is an incredibly good question, and I can answer that question very swiftly. And that is, you cannot be denied due to a pre-existing condition through Penny. So if you're applying for health insurance, dental insurance, what have you, through Penny, if you have a pre-existing condition, come on down. We've got something to help you.
Even if you are active in the treatment, right? Like maybe you're in the middle of something.
Come on down. Come on down. You cannot be denied due to a pre-existing condition. And here's another thing, Jamie, that can impact some folks. If you have dependents, now you've heard Greg say that CHIP will help people, and correct me if I'm wrong, Greg, this is up to 19, correct? Okay, well, guess what? If you have a dependent who is under the age of 26 and you've got a health insurance plan through Penny, we can get them covered. We can get them covered. So that's another important thing to keep in mind. If you have a dependent who is under the age of 26, we can help them stay covered through Penny.
That's excellent. That's really good. I mean, I think everybody who joined us today, kudos to you for recognizing how important this is. And so I'm imagining that many of you will have some follow-up questions because you're already a go-getter, right? So I'm guessing that there'll be some connections happening after this, which is great. That is the whole point. Let's see. I think we may have answered all the questions for today. So that's good in terms of timing, and we can close it up, and hopefully we'll see many of you back tomorrow. Again, you can pop in at 4 when we start. You can pop in a little bit later, but if you really want to talk about your specific situation, that would be a good time to do it. All right, so thanks again, Gregory and Scott. Appreciate your time today. Thanks to everyone for joining us.
All right, thank you, Jamie. Thank you, everybody.
All right, be safe, everyone.